Welcome to the Asia and the Pacific Policy Conference 2014, hosted by the Crawford School of Public Policy at ANU. My name is Belinda Thompson, and I'm here today with Paula Vivili, who is the Acting Director of the Public Health Division of the SPC. Paula, can you start by telling me a little bit about your role with the SPC?
The Public Health Division of the SPC is one of 7 divisions within the Secretariat of the Pacific Community. And it's an organization that provides technical assistance to Pacific Island countries and territories in different areas, including public health. And in public health, we provide a lot of support, mainly in areas of non-communicable diseases, research, evidence, and surveillance, and some other areas as per the country's needs, in addition to facilitating the regional architecture for health, namely the heads of health meetings and the Pacific Health Ministers in conjunction with WHO.
Now, at the conference over the past few days, there's been a lot of talk about non-communicable diseases. Can you just explain what exactly a non-communicable disease is?
Non-communicable diseases, also known as chronic diseases, and by the name it means that it's not communicable. It doesn't spread from one person to the other person. And so the 4 main non-communicable diseases, or NCDs, are cardiovascular disease or heart disease, which causes heart attacks and strokes, diabetes, cancers, and chronic obstructive airway disease, which is lung disease, mostly the result of smoking. There are also some non-communicable diseases that are not really talked about a lot, and this includes mental health and other diseases. But really the big 4 that causes a lot of strife in the Pacific: heart disease, diabetes, cancers, and chronic obstructive airway disease.
Now, besides the human cost of non-communicable disease, there's obviously an economic cost. Can you detail a little bit about how that impacts health in the Pacific?
The economic impact of non-communicable diseases in the Pacific is vast. And of course, this links to the fact that non-communicable diseases are very common in the Pacific. If you look at the data that's available on the burden of disease from non-communicable diseases, the top 10 countries in the world with the highest prevalence of obesity and overweight are from the Pacific. If you look at diabetes, the highest countries with the top 10 countries with the highest rate of diabetes prevalence are from the Pacific as well. To the extent that for overweight and obesity, in some countries, more than 90%, or 9 out of 10 adults in some of these countries are overweight or obese. And for diabetes, up to half the population, or near half the population, have diabetes, which in Australia is about 5% prevalence of diabetes. So if you look at the burden, really it's quite a lot in systems that you would appreciate are not as developed. So the burden itself on the individual, on their family, in the community is a lot. When you look at the economic impact, those that have non-communicable diseases usually are young in their working lifetime, and many of them die still in their working lifetime. And so obviously from a financial income perspective for the family, it affects them. From a country or national perspective, non-communicable diseases actually cost a lot to the countries. In some countries, more than half of their budget is spent on non-communicable diseases. And in many countries in the Pacific, the rate of growth of the economy is actually slower than the rate of the growth of the cost of NCDs. And so it's not a very good situation to be for Pacific Island countries and territories. And obviously, in looking ahead, it is totally necessary to address some of the issues related to it. It's not easy. It's related to culture, trade, behaviors, and we know that behaviors are very, very difficult to change. But with some assistance from all the partners, there's been some encouraging signs, particularly in tobacco control, which shows that change can be made. And we can have some good results.
So just zeroing in on one of those non-communicable diseases, diabetes, obviously if you're starting to look at 50% of the population having diabetes, that's a really significant cost in terms of insulin. Can you run through the kind of impact that has on health budgeting?
The prevalence of diabetes in the 70s were single digits, for the countries where the data is available. And the most recent surveys in Pacific countries done after 2000, the rates for most of the countries are in excess of 20% for adult population, with the highest being about 50%. This doesn't take into account those that are at risk of diabetes or pre-diabetic. And in most countries, if your diabetes prevalence rate is close to 50, then about 25% would be at risk. So we could say in these populations, between 5 and 7 of the adult population is either diabetic or at increased risk of becoming a diabetic, which places a big burden on the system. So if we look at specific figures, for instance, in one of the Pacific countries, you only need 1.3% of the adult population to be diabetic and on insulin, and that would account for the whole drug budget for the whole country. In another country where they have dialysis available, using 2010-11 figures, dialysis cost about $39,000, and most of the 2/3 of the people that had dialysis passed away within 2 or 3 years. The cost of dialysis for this Pacific country is equivalent to 12 times gross national income. WHO recommends that if you are placing an intervention, it should be up to 4 times the GNI. But of course, these decisions are country specific, and the countries ultimately decide how they'll spend their funding. We have some Pacific countries spending money on sending patients for dialysis overseas. In one particular country, close to half the budget is spent on dialyzing patients overseas. So in terms of cost, it's financially it's very costly. Socially it's very costly. It makes poverty worse. Many of the patients cannot afford, for most Pacific countries, they cannot afford dialysis. So if you have kidney problem, you are told to prepare your way. Main complications of diabetes are heart disease, and say in Australia, bypass is an acceptable procedure. In most Pacific Islands, facilities do not allow people to have coronary artery bypass operation. One of the complications of diabetes is kidney failure, which we've discussed. One of the other main complications is eye disease. If you have the advanced state of eye disease, in the Pacific, you don't get offered the services for addressing that. And so, even from a personal, individual level, the cost is quite high. And of course, on the family, we see people who are disabled from their diabetes, and the spouse needs to stay away from work, or maybe some of the children to help look after the diabetic patient. And of course, the other complication is diabetic foot sepsis, which is quite common. You probably have among the highest rates of amputations in the Pacific from diabetes. Services for prosthesis, not the best. And anecdotal evidence indicates that most of the patients who have amputation pass away within 5 years. So it's NCDs is not small, not a small problem. A big burden on the country, financially, socially, and also on the individual.
Now, you referred earlier to obesity as an issue. What is the prevalence of childhood obesity? Is that starting to rise similarly as it is in the adult population?
Well, the 4 stages of the obesity epidemic is women are usually obese, and then the men are obese, and then the young adults before you have childhood obesity. In the Pacific, we are seeing the whole 4 stages. If you're looking at adult data, not hard to find information on that. And in many Pacific countries, the adult prevalence of overweight and obesity is over 90%. So 9 out of 10 persons are overweight or obese. Younger people, some surveys in schools have also found that this is increasingly becoming a problem. Unfortunately, the data for childhood obesity is not as common, but we are seeing a lot of childhood obesity as well. And people think that if we don't intervene during the childhood phase, then obviously once people become adults and become fixed in their ways, it's very difficult to address it. As a consequence of the increased childhood obesity and lifestyle issues, we're seeing very young diabetic patients with type 2 or what used to be adult onset diabetes. Age as young as 10 or 11 or 12, diagnosed with adult onset diabetes or type 2. And so obviously for them, they're set for a life of difficulty. And we say that with good diabetes control, people would probably expect to live a normal life for 20 to 30 years. If you're diagnosed at 10 or 15 even, if you live a normal life for 20 to 30 years, you're in your 40s and you begin to have problems when you should be most useful to the country. And so obviously not very good for the future. But as I said before, there's a lot of efforts from the governments and the countries, as well as the development partners, regional partners as well, to try and help the countries address these issues of NCDs.
Thank you so much for your time, Paula.
You're very welcome. Thank you.